Not everyone should be doing Kegels. Most people aren't doing them correctly. Up to 50% of women, when they are verbally told how to do a Kegel exercise, cannot do it correctly, and that includes fitness professionals. The exercises we have people do are so specific that it doesn't feel like they're doing much. Work on dialing it back so we're really getting to that foundation of what we need and then layering it on from there.
We are busting the biggest myth about postpartum recovery with someone who has helped thousands of women reclaim their body, and it's none other than Dr. Amy from Peak Pelvic Health. Let's start with completely in a dark place. So I don't know anything about what are the changes that women will go through when they are pregnant in their pelvic floor. Can you tell us more about that?
Sure, absolutely. So when we think of the pelvic floor, we think of a hammock of muscles that is part of that bony skeleton or that pelvis itself. So as pregnancy is progressing, the bony skeleton starts to get a little lax, if you will, a little less supported to allow the baby to grow. And so we have postural changes that go along with that, and the pelvic floor being the bottom of that. Really undergoes a lot of stress as well. So those muscles are really lengthened during pregnancy because they're supporting a growing baby, but they're also trying so hard to stabilize that pelvic girdle and keep things as best supported as possible. So they tend to get, most people, long and weak, and they tend to be overworked, and they connect with that deep core, with that abdominal wall in the front and the muscles of our hips and our glutes in the back. So they're really doing a lot of work to stabilize and support that pregnancy.
Okay, and what are the changes women experience after they deliver?
After they deliver, great question. So whether you have a vaginal delivery or a cesarean section delivery, that pelvic floor undergoes a lot of stress in general just from supporting that growing pregnancy. But if you have specifically a vaginal delivery, there's a lot of lengthening for the pushing phase. Women who have longer labor, longer pushing, as you can imagine, would have potentially more trauma to the area because there's been a longer lengthening process for a longer period of time. Those muscles can get really stretched out. There sometimes can be injury that can go along with that, like nerve traction injury. Very rare occasion, or I shouldn't say very rare, but occasionally there could be something that could happen to the tailbone during delivery process as well. But then there could be tearing of that perineal body, that perineal region, or that posterior fourchette that can happen. So all of that can cause some trauma to the pelvic floor muscles. But just that prolonged lengthening period over a period of time can really create muscle, I guess, weakness or fatigue, for lack of a better word, where we really want to work on getting those muscles back to being coordinated and supported again.
Wow, so that's all happens during that short period of time when you are going through the labor, and that there is so much to heal, right? So how long does it take usually to heal that from all the trauma that went through just in that acute phase?
Sure. And I would say too, it would depend on the patient and the mode. So for example, if there's induction with, something like Pitocin that's going to make things happen really quickly, where the body maybe doesn't get to warm up or get ready as easily or as well as somebody who's maybe laboring more naturally and having more time to prepare. That recovery would depend on things like how big that baby was. Was there tearing, and how involved was that tearing? Did you have to have stitches? Were there any other reasons that maybe you couldn't be up and about out of bed right away? Was there hemorrhaging after delivery? So some, medical reasons like that. But otherwise, I would say we're looking at, for scar tissue, to looking at that 6 to 8 week mark for that really to be well healed. But the muscles, the beautiful thing is, right after delivery, really, if you have no complications and you didn't have a C-section, you can start with pelvic floor exercises. And those pelvic floor exercises really will help to pump that blood out of the area and help with that healing process itself.
Oh, that's interesting. So when do you think, what is the earliest time we can start doing pelvic floor exercise after delivery?
I would say again, if you didn't have a C-section, you really could, that same day, just start doing some pelvic floor contractions and relaxation just to connect with that pelvic floor again, because if you're going to get up and walk to the bathroom, we need our pelvic floor to be working just to support us.
Mm-hmm.
If you're moving in bed or holding your baby, that pelvic floor being part of that core, it really is going to need to be supportive. So I would say right away, you can do gentle pelvic floor exercises to help with that healing process and help with that re-education of those muscles and what they're supposed to be doing.
That is interesting. So when we talk about pelvic floor exercises, is it just the Kegel that a lot of us knows, or is there something else that we should be doing?
Yeah, so definitely Kegel. I hesitate to use that word just because it means so many different things to people. But really, if we think about like a true contraction, drawing up and into the pelvic floor, and then a relaxation, letting go, that would be
Uh-huh.
a pelvic floor contraction, or what people would call Kegel exercise, where we really are just using that pelvic floor. Um, but sometimes what we find is that people have a lot of tension sitting in that pelvic floor, and maybe they have a lot of pain. And they're not going to want to do a traditional Kegel, which is really used more for strengthening. They're going to
Mm,
want to do more of a what maybe some people have heard as a reverse Kegel, where
mhm,
we're focusing on that relaxation piece. So we're contracting that pelvic floor, tightening it just enough to turn it on, so we can really focus on the letting go piece. And then we're
mhm.
working on that full range of your muscles versus just a portion of that.
Okay, interesting. So for vaginal, so we are all talking about a vaginal delivery. Is there any changes that happen in cesarean as well? Since like in cesarean, we really don't use like all that contraction doesn't happen, or like delivery doesn't happen through the vagina. It's mostly the C-section part. So does women experience the same changes during C-section, or it's mostly all the vaginal birth?
I would say, surprisingly to most people to find out that it's very similar, that you can still have a lot of pelvic floor pain potentially or muscle shortening. There can definitely be that muscle weakness from the baby sitting on that pelvic floor for
Mhm,
so long, even though you're not pushing through your pelvic floor. So you wouldn't have obviously, tearing with delivery or some of the,
mhm,
potential nerve irritation, things like that. But instead, you would then have that. The abdominal wall being cut through to have that cesarean section. So it's a whole different side of things going on. And with that, because it is considered major abdominal surgery, you could not go to those pelvic floor exercises right away. They wouldn't want you doing anything for at least 2 weeks to allow everything to heal.
Yeah, okay, got it. Okay, so a lot of women, because a lot of women, when I talk to them after the C-section, they are like, they will say, I haven't given vaginal birth, so really I don't need any exercise, any kind of exercise there. But sounds like it's important for both vaginal or C-section delivery.
Yes, absolutely. Because we won't just look at that pelvic floor. We'll look at things like that abdominal wall integrity as well to see if there's any separation of muscle.
Mhm.
Look at that pelvic girdle just to see if things are nice and stable. So pelvic floor being the floor of your core, it's important to assess that, but it's only a part of it.
Yeah. That is very interesting to me. The other question is like, when do women, like now I'm like pregnant, and I'm preparing for my delivery. So when do I really seek for physical therapy or start thinking about exercise? Is it first trimester, second trimester, postpartum? When is really the good time?
Yeah, I love that question. What we know from the research is the better fit that women go into their labor and delivery, the easier their labor and delivery and the easier their recovery. So I really say, if you're someone especially who's exercising and wanting to do that throughout your pregnancy, coming in
Mhm.
early just so we can really see what's going on with your pelvic floor, your pelvic girdle, that core support, your posture, because we know that changes a lot. And then we can work on modifying exercises throughout the pregnancy. If you're
Mhm.
someone who's maybe not really physically active, but just wanting to get to know your body better, we call it push prep. How are we going to get ready to deliver that baby if we are hoping for that vaginal delivery? We can look at things like pelvic floor mobility, your breathing. We can talk about perineal massage and perineal stretching to reduce that risk of tearing during delivery. And then definitely I would recommend that 6-week postpartum check as well, so that we
Yes.
can really, again, assess that pelvic floor. Is there scar tissue that we need to address? Is that pelvic floor moving like we want it to move so it can really support your body? But then also talking to women about, if they're nursing or bottle feeding, if they're diapering, like what are they doing with their bodies and their postures? Because a lot of them come in with neck pain, shoulder pain, all these changes that are happening because they're paying so much attention to being a mom and taking care of that child and not to themselves.
Yeah, and I absolutely agree with that because I went through the same situation. My daughter with special needs, so I'm carrying her all the time. Even now, when she's 7, I'm still carrying, and I do suffer from a lot of back pain.
Okay.
I went through extensive checkup. I went to orthopedic. I went to rheumatologist, got MRI, everything. And then at the end, I was told, "Oh, it's because you didn't rest or you didn't exercise, or it is because of the pregnancy that happened." So now I'm like stuck. There is not much options you can do except physical therapy at this time.
Yeah, and don't ever think it's too late though, because it really is amazing the changes that can still be made.
Uh-huh.
It really is. So sometimes it's a matter of changing habits.
Uh-huh.
Can we work on strength? Can we work on flexibility? Can we work on just habit changes with how we do things in day-to-day life? But don't ever think it's too late.
Okay.
Yeah.
I'm glad to hear that. So for the mom who is postpartum, what do you recommend doing to prevent really that back pain that will happen or that's going to happen because all these activities, they're carrying a baby, not taking care of their posture. What are the things that you think they should be doing or considering?
For the postpartum mom, correct? Yeah.
Mhm.
So I would say really big things to think about is just what you're doing with your body every day. So if you're nursing or bottle feeding, do you have a pillow support? Whether it's my breast friend, a boppy pillow, something where you're bringing baby closer to you and you're not crouching forward over that baby. Same thing
Mhm.
with diapering, bathing. You want to make sure that you're in a position where your back is really well supported and you're
Mhm.
thinking about your posture. If you're picking up baby, if you're picking up the infant carrier, can you really brace your core? So thinking about engaging your abdominal wall, engaging your muscles, and
Mhm.
allowing that to be a stabilizing platform for you. Not
Mhm.
holding your breath when you're doing things is really important, so that we're always thinking about how we're using our body to do things. Sleeping
Mhm.
with a pillow between your knees and ankles, if you're on your side, is a wonderful way to really reduce that back pain as well. And if it's a
Mhm.
long body pillow, you can even hug it so that you're supporting your shoulders also, and you're not kind of laying wonky on something. Yeah.
Yeah, and I do remember using that when I was pregnant. So you would recommend using that even after post-pregnancy because I threw it away when I was like, I'm delivered. I don't need this anymore.
I would. I mean, the boppy pillow and my best friend, they are just wonderful, wonderful things to have.
Yeah.
So yes, I would definitely recommend that even after the fact. Yeah.
Okay. Yeah, I had that hugging kind of thing, like that I used it to support my belly, and then I was like, okay, I'm done with that. I don't need any more.
You wanted more room in the bed, right?
Yeah, we know.
Yeah.
So true. Um, Okay. Let's talk about something that makes me angry. That is, this is all normal. Women has to go through this all the time. It's not something just it's happening to you. Like it's just normal. So people normalize everything like during postpartum. So let's talk about that.
Yeah, so definitely, I always tell people, common, not normal. So, things like leakage of urine after you have a baby, or, if you have low back pain, some of these symptoms that you may have if you're returning to sexual functioning and you're having pain with intimacy or vaginal dryness, these things can be common, but they do
Mhm.
not need to be normal and just accepted by any means. There's always someone you can talk to about that. And of course, I'm biased, but I think a pelvic health physical therapist is a great place to start because we can look at all those things together and make really great suggestions.
Yeah. And what are the consequences? You already said some of them, but what are the consequences when you don't take care of your pelvic health, that you should be doing?
Sure. So some of it can be that you can have leakage of urine, leakage of gas, leakage of stool.
Mhm.
Sometimes people can even experience pelvic organ prolapse, where they start to have some dropping or descent of their bladder, their bowel, or even their uterus itself. They can
Mhm.
have scar tissue problems, meaning that intimacy can be very uncomfortable. Using a tampon or a menstrual cup can be very uncomfortable.
Mhm.
Even for people who have had a cesarean section with that
Mhm.
scar tissue that forms in that lower abdomen, that can lead to issues with painful intercourse, but then also difficulty with abdominal wall tensioning and really being
Mhm.
able to support that body. All of those things can lead to low back pain, hip pain, tailbone pain. Sometimes we see women who have difficulty emptying their bladder, so they're having some retention issues. And it's
Mhm.
because their pelvic floor is maybe sitting a little too engaged, too tight,
Mhm.
and we need to
Mhm.
teach women how to then relax appropriately.
Mhm.
So I would say pain, leakage, prolapse, and then intimacy, pain with intercourse.
Mhm.
And even if you're breastfeeding, right, you're going to keep those hormone fluctuations in your body longer, and that can really mimic the changes we see with estrogen and perimenopause and menopause. So it can create vaginal dryness as well.
Mhm. Wow, that is a lot of consequences of not taking care of your pelvic floor well. So that is very, and I don't think a lot of moms knows this. Like, what is the common myth or so common thing that people are surprised about? Even like someone who is very health conscious, they are surprised to learn about when you talk about like all these pelvic floor, pelvic health, pelvic exercise. Is there something common that people are surprised about?
Yeah. So I think one, people are very surprised to learn that not everyone should be doing Kegels.
Yeah.
I think surprised to learn that most people aren't doing them correctly. There's a research study out there that up to 50% of women, when they are verbally told how to do a Kegel exercise, up to 50% of women cannot do it correctly. And that includes fitness professionals. So you figure 1 in 2 women aren't doing it right.
Mm,
And then I think knowing kind of when we get into pelvic floor work and trying to strengthen and work on support, sometimes
mm,
the exercises we have people do are so specific that it doesn't feel like they're doing much. So they always want to go bigger or try harder. And we really want to work on dialing it back. So we're really getting to that foundation of what we need and then
mm,
layering it on from there.
understood. Yeah, that is a lot of information there. The other question, since we are talking about all these complications, what are the most like severe complications that women can have that they should start CEU or physical therapy as soon as possible? Like they should not be waiting.
Yeah. Is this specifically postpartum we're thinking? Yeah.
Yeah.
So I would say, like, for example, today I had a patient who gave birth less than 2 weeks ago, and it was a home birth.
Mhm,
And she admits that she was probably a little more active after giving birth than she would have been if she did so at the hospital.
mhm,
But she felt a very noticeable dropping down in her vaginal area and was feeling a lot of abdominal discomfort and difficulty kind of getting around. So, for
mhm,
example, what she's describing as hallmark like prolapse symptoms, right?
mhm,
So, that is something that definitely could happen if you have that heaviness, that fullness in the vaginal area. If you're having, at all like difficulty emptying your bladder, that can be really important to seek PT. And obviously there are times you're going to want to see your physician first, your OB/GYN, and make sure that everything is okay and it's not a medical emergency of any
Yeah.
kind.
Mhm,
Difficulty emptying that bladder.
mhm,
Um, if there's a lot of pain, again, that can be due to scar tissue or sometimes just not knowing how to find your muscles and engage them to support and protect your body while you're caring for your little one. So I would say
mhm,
those would probably be the biggest ones.
mhm,
Also, we haven't talked at all about constipation, but sometimes that constipation can be really debilitating for people, and we can work on things like colonic massage, talk about fluid intake, dietary changes, proper defecation mechanics on the toilet, and then how that pelvic floor can play a role so that we can properly
Mm.
have that bowel movement so that we're not having some of that discomfort and pain.
Sure, since we're already having a lot of pain out there, that's one less thing to be worried about. Like if you have that uh, done correctly, yeah, totally. Um, like we are talking about immediate postpartum right now, but how late mom can come to you to get the exercise, get all these things fixed? Like, is there any time? Like, my daughter is 7 years old, so I'm like, I'm too late. I think that like I can't be fixed. Like you said earlier, it's never too late. But is there any limit of like, oh, this is the best time or this is too late that mom should be seeking help?
Great question. So I think, the earlier the better in the sense that you don't have to suffer with a problem.
Mm-hmm.
But then also, many times the longer something has been bothersome to you, the longer it can take for it to get better because we have a lot of, body change and habits and things that are form around that. But I
Yeah.
would say it's never too late. There are always changes that can be made because at the end of the day, those pelvic floor muscles, they are muscles like anything else in our bodies. So form follows function. If we don't use them, we lose them. So something that's not addressed today is not generally just going to go away on its own. And it's something that can become more problematic as we age, as we go through perimenopause, as we go through menopause. Or if we decide we want to become active 10 years later in our life, it's something that could be problematic. So I would say never too early, but also never too late.
Okay, got it. So, what is one advice would you give all the moms who is going through pregnancy, postpartum? Is there something that they need to know or learn? Um, what is the one piece of advice would you give?
I think the biggest thing is just not forgetting themselves in the equation because I really think, especially postpartum moms, they get pregnant, they're so excited, everything's about the pregnancy, then they have the baby, everything's about the baby. And I think many times they can get lost in the mix. So knowing when to ask for help, knowing that self-care is important, knowing that to be that best mom they can be, they really have to practice self-care and take care of themselves and show up for themselves.
Mhm.
Whether that's sleep, whether that's exercise, maybe they need to speak to somebody about maternal mental health counseling. Maybe they need to get out for that walk, but just knowing that that's important too, and their postpartum journey, so they really can be the best mom that they want to be.
I love how you brought about self-care because that is something I really, really want mom to understand. Without you taking good care of yourself, you can't take care of other people. So it's best thing to do for yourself is to take care of themselves. And I really want to like emphasize that
Yeah,
that,
good.
that you just said. So talking about mental health, I something came in my mind just now is how much does mental health leads to pain and all the problems that we are having in the like pelvic floor. Is there any relation or link between them?
Absolutely. There is, we practice really the biopsychosocial approach. So, how much, where it's not just physical, but how
Mhm.
much is the other aspects of our lives playing a role? So, many times we have to not only treat that pelvic floor, but we have to talk about, relaxation techniques, deep breathing. We need to refer out to mental health counseling. Um,
Mm,
so, I think it plays a very big role, especially when there's a pain component or if somebody has not been practicing good self-care for years.
mm,
That can definitely be a limiting factor
mm.
for the prognosis. So very important to have that piece addressed as well.
Okay, got it. Yeah, yeah. Thank you for letting us know about that. Um, I think I did ask a lot of questions, and these were all like interesting questions. And thank you so much. Uh, I think this conversation that we had today is life changing for a lot of women out there who is going through all these changes and just not focusing on the baby and baby product, also focusing on themselves is the key to kind of understand where they are at, where what they need help with, whom they seek help with. like pelvic mental health, pelvic health. So that's all out there. And a lot of people like you, me, we are all there to help them. And they just need to reach out and understand where they are and how to get help. So before I wrap up, I have quick questions for you. So Kegels during pregnancy, yes or no?
They can absolutely be done, yes.
Okay. Exercise during early postpartum, when and what?
Great question. So a lot of low level things. So like pelvic floor exercises, some pelvic braces,
Uh-huh.
anything pretty much that you could do laying down in bed would be okay. And then just slowly adding to that.
Mhm.
If you were somebody who wanted to get back to your gym routine, for example, you'd want that 6 weeks postpartum clearance from your physician. And then
Mhm.
just starting smaller scale and grading it upward from there. But definitely things like walking, being outside, moving your body, very, very important. So you can pretty much do that unless you've
Mhm.
had that C-section, have any precautions right after.
Yeah, okay, got it. 6 after baby, what timeline is actually realistic?
From everything we've learned, really that 6 week mark, you want to wait for that clearance from the OBGYN.
Uh-huh.
Um, A lot of people will wait longer because they're fearful. So I think it
Mhm.
has to be when we go back to that mental health piece, not
Yeah,
only physically ready, but mentally ready as well.
yeah.
Um, so I would say 6 weeks would be the earliest.
Okay.
And just knowing that if there is pain, there's discussion like lubrications that can be used, and things of that nature. So it doesn't have to be painful as those tissues are getting used to stretching again.
Got it. Okay. Um, yeah. So, thank you for all this conversation, and I'm sure it's going to change life of so many women out there. For someone who wants to reach out to you, who wants to know more about you, where can they find you?
Yeah, absolutely. So they can either check my website out, and that's www.peakpelvichealth.com, or they
Mm-hmm.
can send me an email, and that'd be info@Peak Pelvic Health, or my
Mm-hmm.
number is 919-335-5837. And they
Mm-hmm.
can schedule a free 15-minute video consultation where we can talk about things and then determine whether or not pelvic health physical therapy, and my practice would be a good fit for them.
Okay, that's awesome. That's a great resource, and I encourage all mom who is undergoing some pain or issue with pelvic health to definitely reach out to Amy. She's wonderful. Um,
Thank you very much.
So if this conversation resonates with you and you want to learn more about pelvic health, momkins, postpartum wellness, how to thrive after postpartum, please don't forget to like, subscribe, and share these videos to some moms, other moms who would benefit watching these videos. Thank you everyone for joining in today. I'm so happy that you are all here. And until next time, remember you are not just surviving motherhood. You are here to thrive the motherhood.